will lose its power. Yeah. Reaches the highest mountain, and it flows to the lowest valley. Good morning, depending on where you're watching me from this time. This is Nurse Francisca. I'm here again to complete on the topic I presented to us few days back on diabetes. Okay, I call back to your attention that we discussed about the definition, what is diabetes, and the types of diabetes. And we came along and said we have diabetes type 1 and type 2. Okay, and the definition is when the insulin that's supposed to control our sugar level in our blood system is not being produced in the pancreas, or the one that is being produced is not properly absorbed or utilized by our body system, then thereby resulting into the accumulation of sugar in our body system. So that's the simple definition of diabetes. And today we are going to talk about what causes the causes of diabetes. How does it start? When somebody becomes diabetic, what brought about it? It could be genetical. This is the most important one of the causes. When it runs in your family, family history, okay, and even in your health, there are other diagnoses, these sicknesses or diseases that can eventually trigger your blood sugar, spiking up your blood sugar. So it depends on the type of diabetes you have. Is it type 1 or type 2? So if it's type 1 is called an autoimmune diabetes. That's when your system starts attacking and destroying the cells in the pancreas where the insulin is being manufactured. You are bound, your sugar level in your blood is bound to start rising, okay? Because the pancreas, that's organ that is responsible to produce this very hormone, insulin, is no more effective. It has been damaged. It has been attacked by your own body. Okay, when you start recognizing maybe the body, in terms of infection, the body will start attacking that organ, the pancreas. It then means it distorts the functioning, and it may result into not producing enough, or even not producing insulin at all. So which may result into a build-up of your sugar level in your blood system. That is simply the cause of especially type 1 diabetes. And type 2 diabetes is mostly by habits, caused mostly by habits. That's when your body system is not absorbing adequate the insulin being manufactured by the pancreas. So it's bound to cause type 1 diabetes. Okay, so and what causes such the condition? Mostly those people that are obese, overweight is very, very bad. It's in our health, very, very much. That is why it is very, very important to make sure try as much as possible to control your weight. And how do you do that? By controlling what your food, your what you eat. Okay, you eat healthy food and not mostly junks every time. Most people, they enjoy it. It's very, very tasty. Junk foods are the food is very, very tasty, but the resultant consequences is very, very devastating. So we should checkmate what we eat so that we keep healthy, eating healthy food. And another one is again with type 2 diabetes is family history can cause that. If you have a genetical or family history, diabetes runs in your family as well, that could cause that diabetes can spike up. And there are people who are not physically active. You don't exercise, you don't do, you just eat, from month to month, from year to year. You can never engage yourself in one physical exercise, whether indoor or to the gym or whatever. It is very, very bad, and this may result into obesity. You start getting bigger and bigger, building muscle fat in your body system, and your internal organs are not put into action. They are not, helped to and be active in very, very active mood. Because when you are moving your body parts, whether the internal or the external body parts, the blood seem to circulate more. That's your heartbeat, your body fluids, everything. And you do some work. As you do some work, you sweat out, you burn calories. It is very, very important. It helps your heart, it helps your body sugar level in your system. It helps to checkmate it. So physical exercise and eating good is one of the ways you can indulge, and you checkmate. So obesity, not eating healthy, and not engaging in physical exercise can cause what? Type 2 diabetes. So how do we the treatment and prevention of that? There are the Diabetes Canada is here already available. The information, whether on the public space, in the websites, you can go ahead to check and find solutions, get information online. Diabetes Canada, it has provided information to support so that you can live a normal, healthy life. Okay, and talking to other people about your situation. You may get help, okay, and some advice, information that will help you manage your diabetes, whichever one. And as I said, a positive and realistic attitude, okay, towards your diabetes can help you manage it. A positive attitude, okay. You make sure you take your medication, you exercise, all this. A positive attitude, doing all those things that can, if you do them, it can help you to manage your diabetes. It is very, very important. And eating healthy food, regular exercise, and losing weight, as I earlier on enumerated. You can live a long and healthy life by keeping your blood sugar level in the target said by you or your healthcare provider. Okay, you can live. Many people, there are people that have lived for 10 years, 20 years, even 30 years managing diabetes, whether type 1 or type 2, and they live normal, good life. You won't even know because they have a positive attitude in order to manage their diabetes. Okay, so they, if they like taking their medication, as I said, is another factor, another way you can treat, diabetes. If especially type 1 that is insulin dependent, you make sure you take your insulin after checking your blood sugar level. Okay, each time in the hospital we must do the blood sugar level to establish the value of that, the level of sugar in your blood system before we go. Even the doctors will be able to prescribe any injectable or medication. There are numerous medication that helps to control your sugar level in your blood system, and you make sure you take regularly, you go by it, do your exercise, you eat healthy. These are all the factors or the measures you can take in order to checkmate your diabetes. Okay, and it says above or high blood sugar can cause serious complication. As a matter of fact, if it is not handled well, if it is not diagnosed at the right time and not handled very properly, especially type 1, the insulin dependent. So it can cause a devastating effect if it is not handled. So let us not allow it to get to that level. You see some people whose own is read them, they have leg amputation because of poor circulation at your extremities, especially your leg, lower legs. Okay, and it has vision loss due to the brain pressure on your brain. Okay, caused by the high blood sugar content, that's called the hyperglycemia in your blood. It targets your lower extremities, your eyes. Okay, and even your skin. Most patients that have diabetes, they have skin blood problem. You see, they develop serious body ulcers at their coccyx, at their in any part of the body that will have a friction with the beddings where they are lying. So when such little something triggers body ulcer, those kind of wound caused by the effect of that blood sugar, high blood sugar in your system. So to prevent such, you better make hair while sun shines by preventing it. And if you happen to already have it, you make sure you go by the rules in order to treat it. Okay, and to put it under control. You may not, like the type 1, it will be difficult to eradicate, to contain it. But type 2, with adequate healthy diet, with regular exercise and losing weight. And whenever as you are exercising, invariably you are losing weight, you are definitely bound to lose weight. It is very, very important. So guys, there's another artificial insulin aside, but as I mentioned, must be taken, and other medication. that will that are necessary to go with that, and you will see. And again, there's another aspect of diabetes. I want to let you people know. It's called gestational diabetes. This is diabetes for mostly pregnant women. When they are pregnant, that's when you experience this type of diabetes, due to their eating habits, not exercising well, or it could be even genetical. In one way or the other, you see them, their blood sugar level will spike at pregnancy, when they are pregnant. So, and some of them, most women that are pregnant may not have diabetes at all, at all. But as soon as they are pregnant, especially on that first and third trimester, you see them, that blood sugar, they start to experience the blood diabetes. So it is very, very pertinent and important for when you are pregnant that you still exercise. It's not sickness. Pregnancy is not sickness. Okay, you are still strong. You accept at the first trimester, they know the early pregnancy symptoms and sicknesses. But when once you overcome that, or that very stage, go into your second and third year, I believe you will start becoming stronger. So engage yourself in adequate exercises, physical exercise, once a pregnant woman can handle. Okay, and you make sure you eat well, eat well, eat well. Okay, and before you know it, some of them be at birth. When once you have your baby, it vanishes. Why some of them are degenerating into complications, okay, that may affect even the baby. Okay, so let us always checkmate. Let us know that diabetes is a devastating disease, okay, all over the whole world, both here in North America and even in the third world countries. So let us try. Some people, I remember in those days, our uncles, we never knew that they keep on eating unripe plantain. Well, later I come to the realization that if unripe plantain is very, very, very recommended for those who have, especially even type 1 or type 2 diabetes, because if the sugar content or it is not there, it contains iron, it contains other this thing, and the carbohydrate. So you eat healthy, eat beans, vegetables, fruits. These are the things, food you will be eating, and not junk food all day long. It does not help, even in health, within your health in a holistic way, but not to talk of when you are diabetic. So let us try as much as possible. You see me, I always engage myself in one little exercise or the other to keep my body healthy, because they say health is wealth. When you are not well, when you are not feeling well, my dear, even your best meal will become poison to you. So let us try, do our own part, and leave the rest to God, who has promised to be with us, to cover, to guide us, and to give us good health, even as our soul prospers. As you do so, God will crown it and make a way for you. Okay, so that you will be happy on this earth until Jesus comes, both here and in heaven. Okay, so God bless you. I encourage you, share this very upload, okay, like it and comment. And when you listen to this, especially those who are having this disease is going to help you so well. Okay, right from the what is diabetes, the types of diabetes, the causes of diabetes, the prevention and the treatment. Okay, and where you can get the resources that will be of help to you. Okay, in case, make sure you don't keep it to yourself. Share it among your peers, healthcare providers, your friends. You never can know who has one thing or the other, one advice, one opinion, or one experience is gonna help you a great deal. Okay, and psychologically, when you say it out, when you share your burden, your problem with one another, you relieve yourself, your of panic, anxiety, worry, hopelessness. It helps your neurological condition to be checkmate. You see even your skin everywhere, because you let it go, you let it go, you let it go. You do the right thing at the right time in order to help yourself manage your diabetes. God bless you all. I see you again. Bye.